Hi, I'm Sally Spencer Thomas, and I'm here to share a little bit about the HOPE certification process. And HOPE stands for Helping Our People Elevate Through Tough Times, and it's a workplace resilience, mental health, and suicide prevention certification. It's just like the LEED certification. I'm pretty sure most of you have heard of that process where people earn bronze, silver, gold, platinum levels for implementing best practices. And then people can shorthand the conversation. Hey, what's your certification level? And people have a general sense of how invested those organizations are in implementing best practices. Same thing here. So this is about the implementation of 9 practices as guided by 8 guiding principles of some national guidelines that were developed by hundreds of stakeholders, people across multiple industries, public sector, private sector, nonprofit sector, people with a whole host of lived experience around mental health, addiction, suicide, and all kinds of related issues, different roles, HR, peer support, safety folks, and just lots and lots of people with lived experience. And together, they've put together this 9 practices national guidelines. The HOPE certification then takes those guidelines and implements them to the next level with a third-party verification system so that we can evaluate the approaches organizations are taking in these 9 practices and make sure that they are adhering to best standards and promising guidelines so that we can help ensure that we're doing the best we can with the science that we have today to help people come through difficult times and possibly even save people's lives with workplace types of programs, interventions, policies, and so on. So this certification, because it was developed by a wide swath of different types of stakeholders, we wanted to make sure that it was adaptable to small organizations, large organizations, different industries, but that it was also customizable and culturally responsive. And we think we've done it. We've been able to test it out in a number of different places. So the infrastructure is there, and then those practices can be tailored to meet the different types of organizations that are implementing them. And then this again can be a shorthand way for people to communicate, hey, I'm a bronze level HOPE certified organization. And we have a sense like you've taken some steps to really improve the well-being beyond just offering good benefits, beyond just having a disability leave for people who need to take some time to get into long-term recovery, that you're really thinking about upstream work and how to respond to mental health emergencies beyond just mental health resources. There's a lot to this, and this helps people understand how invested you have become. We are currently piloting the implementation of this HOPE certification with the state of New York within the construction industry. And we've been learning a lot over the last 6 months, and we are now ready to roll it out to other cohorts, either organized by region or by industry. It is ready for prime time. So who gets involved in a certification process like this? Usually we have a team of 5 is like the magic number, 5 to 7 champions from within an organization, somebody usually representing some position of leadership, who can help make decisions and allocate resources. Usually 1 or 2 people from an implementation role. It's really helpful to have someone from HR involved, maybe safety, or sometimes the communication folks are really helpful. And then certainly many people with lived experience. And in fact, often the people who raise their hands to help with this have lost or loved someone who has experienced suicide intensity or addictive behaviors or overdose. They have also, many people have survived these kinds of experiences themselves, and they make incredible informants and champions because of their passion and their lived expertise. So how this rolls out when we have a cohort, and usually, 3 would be the minimum, but 10 would probably be the maximum number of organizations we would invite into a cohort to go through this together. We kick it off by a HOPE Summit, where we invite all interested parties to see if it seems like a good fit, if it seems like they have the resources and bandwidth to pull it off. And then once we have received their applications to enroll into the pilot, we start going through a 12-month program where we meet quarterly. The first part of the effort is around developing a needs and strengths assessment and starting to engage leadership. And that's the bronze level. The silver level looks at some of the upstream approaches and proactive prevention that will help mitigate the kinds of distress and despair workers are experiencing, and also build up individual, team, and culture resilience. The next level, the gold level, looks at more of some of the midstream approaches around self-orientation, around taking care of this part of your health yourself, about training, about peer support, really being able to catch problems as they're emerging and not waiting until things are catastrophic. And then the final phase is around downstream efforts to prepare ourselves for mental health emergencies like suicide or suicide attempts or overdose. And then finally, how to give back to the community to keep this going. Throughout the whole thing, we do a lot of evaluation and recognizing and rewarding incredible efforts and using them as case examples for similar types of organizations. So these are the 9 practices that we cover. I don't have time in this short overview to go into them, but they're again organized by upstream, proactive efforts, midstream, early identification and intervention, and then downstream responding to mental health emergencies. So in 2022, we've kicked off this HOPE certification process to go deeper into each of these practices, have accountability mechanisms that hold people to best practice and verification of completion. We have knowledge quizzes. We work with a partner called Evergreen Certification to make sure that everybody is completing all of the action steps. We have experts like myself and others there to be mentors and provide technical assistance when organizations get stuck or have questions about things. And through the cohort model, we develop a community of practice where organizations get to know each other and learn from each other and support each other on this journey. So these are the partners that are involved in HOPE certification. It's supported by the American Foundation for Suicide Prevention and United Suicide Survivors International as content experts. And then Evergreen Certification is our certification partner that helps people work their way through bronze, silver, gold, and platinum levels. And that is it. If you have questions, please direct them to me. My email address and cell phone are there at the bottom, and I look forward to connecting with any interested parties.